Good afternoon. Thank you for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Monday, March the 8th. I'll turn things over now immediately to Dr. Fitzgerald for the latest update.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us. Since the media advisory yesterday, we have 3 new confirmed cases of COVID-19 in our province, all in Eastern Health and all contacts of previous cases. One is between 40 and 49, one between 60 and 69, and one over the age of 70. The total number of cases in our province is now 1,009. There have been 6 new recoveries in Eastern Health, leaving 84 active cases in the province. 3 people are in hospital due to COVID-19, and a total of 116,238 people have been tested. I'd like to begin with an update on the case identified in Labrador Grenfell Health last week. After extensive testing and investigation, Public Health has not been able to determine the source of the infection. Sometimes, as hard as we try, we cannot find the answers that we're looking for. That being said, all contacts of the individual have been identified and are isolating. There has been testing in the community, and we are confident that there is no onward spread of the virus at this time. As always, it is a reminder that COVID can show up anywhere at any time, and people need to continue practicing their trusted public health measures to reduce their risk. Keep your contacts as low as possible. Avoid public spaces as much as you can. Wear your mask and physically distance from those outside your household. Wash your hands well and wash them often, or use hand sanitizer. The Public Health Laboratory performed approximately 2,000 tests since Friday, and this increase is largely the result of voluntary asymptomatic testing being conducted in the Eastern Health region. As a reminder, Eastern Health is offering voluntary testing to anyone who wants it, even if you do not have COVID-19 symptoms. Testing centres are located in Mount Pearl, St. John's, Burin, Harbour Grace, and Clarenville. More will be established this week in Trepassey, Bonavista, and Placentia. If you would like to be tested, you will need to have an appointment, and you can book a test by completing the online self-assessment tool or by calling 811 if you do not have access to the internet. I encourage people of all ages to book a test, even if you are young and don't feel that you're at risk. We know that many individuals tested during the outbreak were asymptomatic, and yet were still able to transmit the virus. This surveillance testing is important. We need to have confidence that the risk of community spread is reduced before we can ease restrictions. We all have a delicate balance to achieve in the months ahead. We are working to vaccinate as many people as we can while preventing the spread of COVID and permitting society to function in a safe manner. We now have approximately 63,000 individuals 70 and over pre-registered for their COVID-19 vaccine. As a reminder, the system is now open to everyone in the 70 and over age group. You can visit our website at gov.nl.ca or call 1-833-668-3930 to pre-register. If you have a family member or friend in this age group, please reach out and ask if they need assistance with registering. We are also issuing a warning of fraudulent telephone calls involving the COVID-19 vaccination. We have received reports about callers asking for people to pay for their COVID-19 pre-registration and vaccination. This is a scam. Pre-registration and vaccination is free. Public Health would not make these telephone calls or leave such messages. Anyone who receives a suspicious telephone call or message should immediately report it to the nearest police detachment. Today is International Women's Day, a day that is very near and dear to me personally. I would like to acknowledge the remarkable women across our healthcare system who are working to support our COVID-19 response. While I may be the face of the response to the pandemic, there are thousands of women across our province who have contributed to Newfoundland and Labrador's efforts and success. Women are on the front lines in the community and acute care, as well as in senior leadership roles in all the regional health authorities. Within our department, we have strong representation of women, including our Assistant Deputy Minister responsible for Public Health and our Deputy Minister, who has been supporting us through this pandemic since before day one. Lastly, but certainly not least, I have the pleasure and privilege of working with an amazing group of women on my core public health team. There are not enough words to express my gratitude for their unwavering commitment over the past year. Not only have they done outstanding work, they really have been my rock. As a recap for those who may have just joined us, we have 3 new confirmed cases since yesterday's media advisory. The total number of cases in the province is 1,009. After tackling our second COVID outbreak, the strength and resilience of people in this province has never been clearer. It is our common values and shared bonds of hope that will keep us united as we continue to face this pandemic. So hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. Today we begin our 4th week of lockdown on the Avalon and 2nd week of alert level 4 throughout the rest of the province. Our numbers have continued to move in the right direction. Single digits daily, more recoveries. The even better news again is that vaccines and the fact that this week alone we will receive 19,000 doses. Let's all keep this momentum in mind. Each and every person in this province is part of this recovery. Every sacrifice you have made, every time you've walked back to your car to grab your mask, every time you stayed in your bubble, all these efforts are paying off. So let's keep things going in the right direction. Today is, of course, International Women's Day. It's a day to celebrate the many achievements that women and girls make each and every day in Newfoundland and Labrador, in Canada, and around the world. Important strides have been made towards making this a more inclusive world, but there's still so much to be done. I was very happy to learn that Dr. Fitzgerald was recognized by the YWCA with an honorary 2021 Woman of Distinction Award, and recognized on Atlantic Business Magazine's 25 Most Powerful Women list. In the last year, throughout the pandemic, Dr. Fitzgerald exemplified leadership and compassion as she navigated us through uncharted territories. Those earliest weeks, the lockdown, the measures that needed to be put in place, none of us had seen anything like it before. But through it all, Dr. Fitzgerald was the steady hand and the voice of knowledge and reassurance that we all needed. Always humble, she'll be the first to give credit to her team, who are undoubtedly working tirelessly as well. But like it or not, Dr. Fitzgerald, you're an example to everyone in this province of what it means to step up. It is appropriate then that this year's theme for International Women's Day is Women Leadership, Achieving an Equal Future in a COVID-19 World. It's also an opportune time to lift up the many incredible organizations in our province who are on the front lines helping women every single day. Thank you for all the work that you do and for being there for all our women and girls throughout the province. With that, I'll turn it over to Minister Haggie for a brief update.
Thank you very much, Premier. It is day 365, 1 year exactly of our media briefings since we declared or got involved in this pandemic. I think it was actually a day or two before it was declared. I think it's only fitting, again, just to echo everyone's comments about Dr. Fitzgerald and her congratulations on her award, and also to recognize the team of very impressive women who she has supporting her and me through this pandemic. I would be remiss in trying to list them all off because I would worry I would miss one, and that would be worse than not mentioning anyone. So congratulations and my earnest thanks for all that you do. I want to just develop a little bit around the vaccine. There was a significant amount of questions around that on Friday. As the Premier's referenced, we've been promised just over 19,000 doses of each of the 3 vaccines in total this week. On Friday, as a snapshot, the people we believe we have left to vaccinate, there were 379,400 of them. As of that same time, the doses we have been promised between now and the end of June or first week in July add up to 388,000 doses. So you see, our planning would suggest that we could be on track to have everyone's first dose done by the end of June or early July. The reason we have gone with groups and phases like the NACI recommendations have put out is an insurance policy, quite frankly, because of supply chain challenges and issues. We don't want to find ourselves in a situation where we have vulnerable seniors, for example, without vaccines, whereas other low-risk individuals will have had their vaccine simply because they were first come, first served on a mass campaign. For those people in groups that have been mentioned under phase 2, such as first responders, we will be reaching out to your organization who will supply us with information about your location and needs. So you as individuals do not need to reach out to register. As for the other groups listed in phase 2 and subsequently, we will make it quite plain through briefings like this and through news releases what the mechanism will be for you in plenty of time for you to make the appropriate arrangement and to register. We have seen low numbers and our recoveries consistently have been greater than the new cases. So things are going in the right direction, and it is simply a matter of perseverance. So I think, again, I would close by repeating a line of Dr. Fitzgerald, which she didn't use today for other reasons, and that's hold fast Newfoundland and Labrador. We're getting there, and we can get there. So with that, Premier, I'll hand things back to yourself.
Well, thanks, Minister. I'll now invite questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 5 reporters registered for today's call. The question and answer session will be conducted in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have 1 final question. Our first questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. As the Avalon heads into what is potentially its final week of alert level 5, are we looking at Friday as a potential to go into alert level 4, or where are we looking to go right now? Would it just be back through the alert levels? Are we looking to jump levels?
So we'll be reassessing things later in the week, and certainly by Friday we'll have an announcement in that regard. I don't anticipate that we will be skipping levels. You know, the whole point of this and what we've heard certainly in other areas is that you need to reopen slowly and just, you know, as people move about more, as more people are busy doing things, we need to make sure we take it slowly so that if we start to see a resurgence, it's not as intense as what we saw initially, right? So I don't anticipate that we will be jumping levels, but we certainly will have more information by Friday.
Thank you. And as the regional health authorities begin to vaccinate those 85 and older, and some areas 70 and older, what's being done to vaccinate those who have mobility issues and might not be able to make it to a vaccination clinic?
We have several arrangements there, Kellyanne, not least of which is moving the clinics around as time goes by. So we'll start with the bigger population hubs and then move out into smaller ones over subsequent weeks. But if there are significant mobility issues, then the local public health can be contacted through the RHA, and arrangements, if need be, can be made to vaccinate somebody at home. If it's a matter of travel, then there are mechanisms through income support, medical transportation that can deal with those challenges too. So we'll make those obvious and more public if that helps.
Thank you.
Our next questions are from Noah Shepard with VOCM. Please go ahead.
Hello. Do you know if the case linked to the health center in St. Anthony is one of the variants?
No, we don't have that information, unfortunately.
Okay. What is the update on the number of people taking advantage of the voluntary spot testing?
So over the weekend, the lab performed about 2,000 tests, and I would think that probably about 1,600 of those could be contributed to that testing, just based on what had been happening at the labs on days before. Well, 15 to 1,600, I guess we'll say. And so, you know, I think there's been some good response to date. We would certainly encourage people to continue to go out. It's my understanding is it's a very smooth process. very quick now to, between actually registering for an appointment and actually getting your appointment and getting your swab done. So a pretty quick turnaround from what I understand. I know my family and I all went out on Saturday and got tested. It was very quick. We had our results the next morning, and it was a very smooth fare. So I would encourage anyone to get out there.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
So this week it looks like the province will be receiving about 20,000 vaccine doses, which is a huge increase considering over 2.5 months we've only seen about 40,000 doses total. What are we doing in order to ramp up for deliveries, and how is the delivery of these vaccines going to work physically?
Probably best for them.
I can. Oh, Janice.
No, that's fine. You go ahead.
Okay, good question, Peter. The mechanisms that the RHAs have in place currently through public health can deliver those amounts without too much of a challenge. We are cautiously optimistic that we will get significant increases on the weekly allocations as time goes by. We have the capacity, we believe, to deliver a significantly greater number. We've also been speaking with the Pharmacists Association. We've been speaking with the Newfoundland and Labrador Medical Association, and those will be our next tier of providers. And then in addition to that, we have some contingency planning around micro-credentialing and retired staff, or even diverting staff from other planned routine duties within the RHAs. The clinics that are set up at the moment are through the RHAs, and they have an operational role at that level. So they've picked areas where they think they will be able to deliver the most number with the fastest result. And then as time goes by, they'll move that round, as I mentioned earlier on, to make sure there is geographical coverage throughout their regions. So those plans are very mature and are looked at on a daily basis to see if they need to be adjusted.
And I've heard frustration from people with the fact that Central and Western seem to be getting more doses and are farther along on their vaccination route. Meanwhile, Eastern Health is the area that's been seeing the bulk of the cases. Why are we seeing this unevenness in how the vaccine is being rolled out?
Sorry, I was on mute. From the point of view of vaccine delivery, again, that is an operational issue. I mean, Eastern Health will be starting in the next day or so. They are a few days behind. They have not been sitting on their hands. Public health and CDC nurses in Eastern have been involved, for example, in the spot testing and this kind of thing. Mr. Diamond has assured us through our usual mechanisms of communication that this will not be a persistent problem. I think it's just the way things rolled out. So I wouldn't read anything sinister into it. And I think there will be a significant catch-up once the vaccine in Eastern starts to roll out. They're also a pretty big geographical area as well, with multiple facilities. They've got half the province's population, so there may be factors there. But I'm not advised there's any significant challenge to dealing with this few days delay.
Thanks.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Good afternoon. Dr. Fitzgerald, you've been quite clear throughout this whole ordeal that you're willing to change gears according to the new evidence. And you've done that a couple of times recently, so I just wanted to make sure I understand what changed in these cases. First of all is this idea of random asymptomatic testing, which was always considered to be a waste of resources in previous. What is it that changed your mind in this case that was something that needed to be done now?
So B117 and the fact that we were, in a situation of low prevalence, then certainly doing random asymptomatic testing in the past had not been shown to be as much benefit as what we would have hoped. We ended up with lots of people getting tested. false positives and an increased turnaround time for all people getting tested, including those who had symptoms or who were exposed through being a contact. So that's not necessarily the best use of resources. This time, we knew we had a large outbreak. We knew that it spread quite easily and quite quickly. And now we're trying to make sure that, there's not pockets and chains of transmission out there that we don't know about. And so that's why we're looking for cases in the eastern area. That's not to say that we'll continue to do random asymptomatic testing forever, but there may be situations where this type of testing would be more useful than other situations, those are things that we are looking at right now and how we can use this going forward.
Okay, thank you. And the other thing was when the immunization committee first gave an okay to go off-label in terms of the delay between vaccine doses, you were reluctant to do that at the time, but now you are quite happy to go with the even higher delays now between doses. Was that also the variant outbreak that convinced you to follow those recommendations?
So I think for, with regard to extending the dose, it was really the new evidence that came forward. We'd had a 2 to 3 months experience with this vaccine, and I think really it was what we were seeing, the evidence that we saw that came out of Quebec and out of BC, as well as what we were seeing in the UK, really made a difference to the National Advisory Committee on Immunisation as to what they felt was reasonable to recommend. And so, that's been our advice committee. That's been the committee that we have always deferred to when it comes to vaccinations. We've taken their advice very seriously. If they felt that they were in a situation that they could recommend that, then we would certainly be open to following that. And so it was really more about the evidence, although being through this big outbreak and seeing how fast this variant could spread and how quickly things went from being lovely to being way less than lovely. I think that certainly reinforced to us the importance of having those vulnerable populations vaccinated with at least one dose of an effective, safe vaccine.
Thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Hello. Prince Edward Island's Premier Dennis King said over the weekend that he hopes for a return to the Atlantic bubble by April. Is that timeline correct?
As we've said before, Patrick, we're going to evaluate the evidence as it evolves. Certainly, our primary focus right now is still containing the outbreak that occurred, believe it or not, three odd weeks ago now. And to get our own house in order first before considering looking at expanding our involvement in the Atlantic bubble. But it's certainly something that we're interested in pursuing. We just need to make sure that we get our own numbers under control quickly here now, which, thanks to Dr. Fitzgerald and our team, we've done.
I guess that's exactly it. Now that we have our numbers under control, or relatively under control, is that a timeline that is possible for Newfoundland and Labrador? And I guess as well, Premier, when is the last time you spoke with the other premiers in Atlantic Canada about the bubble and a possible return to the bubble?
Well, the timeline certainly would seem to work if you look at where how we've contained the numbers. But as Dr. Fitzgerald has said many times, the only thing that's certain is the uncertainty in this. And if we could have an unanticipated outbreak, and then we'd have to reevaluate. We also need to look at, as we've said from day one, the epidemiology in other jurisdictions in the other Atlantic provinces before we would consider the bubble again. But hopefully, as the vaccines continue to roll out and as the numbers continue to recover, both in our province and others, that is certainly something we'd entertain in the medium term. But again, it's a bit premature, I think, to comment fully and commit fully to it to a specific date To commit to the concept, sure, but to commit to a date is a bit premature. I do have intermittent conversations with Premier King and the other Atlantic premiers. I've received a text from Premier King just a few days ago, in which we were just discussing how each other was doing, but that's about it.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Minister Haggie, you may have mentioned this in your preamble, but just wondering when we can expect AstraZeneca to be here and when those first doses to first responders are expected, if there's a process for them to register, getting a lot of questions from them and how they know when they're going to be getting this shot.
To answer the second part of your question first, Kellyanne, our aim is to reach out to first responders through either their employers or their professional associations, so firefighters, police officers, paramedics, that kind of thing. So that will not require them to register, and that process is started already through the department. In terms of AstraZeneca, we have been advised to expect it by the end of this week. Once it's here and the shipment is checked, then it will simply be a matter of distributing it in shares across the RHA to get out to first responders.
Thank you. And Dr. Fitzgerald, when we looked at the asymptomatic testing that's ongoing and the people who are availing of this service, are we looking to open it up to the rest of the province so we can continue to receive information and data on potential other cases we've seen? And I know we did this earlier on, but is it something we can look to continue going forward?
So I think what we'll see, and what we've recommended in other situations, when we've been like in Harbour Breton, when we had cases there where we didn't know exactly what the source was, we had opened it up to more general testing in that situation, and in other places too across the province if we weren't aware. So that will continue to be part of that source investigation that we look for, part of that investigation of a case that's non-epi linked. And in this situation where we had such a big outbreak, we wanted to make sure that we were doing a snapshot of the region before we move to opening things up. So, as I said before, I don't know that it'll be something we'll be continuing to do regularly on an ongoing basis, but it'll certainly be something we look at doing in response to any non-epi-linked cases, trying to find out those sources or seeing if there was any spread prior to the case that came to our attention. Those are all things that we would try to do with this broader asymptomatic testing. So there's a place for it, but I think we have to be judicious. We don't want to get into a situation where, it slows down our turnaround time. We're doing so much testing of asymptomatic people that it slows down our turnaround time for those tests where we really need to know things quickly. So.
Thank you.
Our next questions are from Noah Shepherd with VOCM. Please go ahead.
Nova Scotia has incorporated pharmacies and drugstores in the vaccine rollout. Is there any thought of when this province will see that and where those could pop up?
Certainly a good question. We've been in discussions with the pharmacists and the medical association. Some of the challenges initially were around logistics and cold chain. Some pharmacies are equipped for cold chain, others are less so. And certainly physicians' offices are more used to the 2 to 8 vaccines. I think at the moment it's simply been an issue of vaccine supply. They're there. We haven't got to a situation where adding them in will speed things up. So at such a time as we find ourselves with a surfeit of vaccine, shall we say, that's the time when we would want to incorporate them. And maybe later as well, as more vaccines become available, it may be that it'd be easier to give the 2 to 8 vaccines to physicians and that kind of thing. So those are all discussions that we're having. But at the moment, our challenge simply is getting the vaccine into the province so we can then get it into people's arms.
Will the province be securing any doses of the Johnson & Johnson single-shot vaccine?
Well, we haven't received information from the federal government on the distribution of that just yet, but we would expect our fair share based on per capita from the federal government's supply.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
Thank you. Question for Dr. Fitzgerald, because I know how much she loves talking about herself. What's your reaction to being named an honorary woman of distinction by the YWCA?
So, it's a very, I was very, very honored to receive the award. The YWCA is a great organization that does some really important work in making sure that, they work towards making sure they have a safe, supportive, and empowering community for women. And I think that's really, that's something that's near and dear to my heart. So to be considered for this award, for the award from them was really, truly humbling. So I was very honored, and I've already, well, I don't know if they've received, but a little video of thanks has gone their way, but I'm not sure if they've gotten it just yet.
And a question about lifting restrictions for people who are vaccinated. The CDC announced today that they're now recommending that people who are vaccinated who want to gather together in people's homes, for example, can do that. Considering we have communities on the coast of Labrador where we've essentially reached, 75% or so of the population are fully vaccinated, why aren't we lifting some restrictions to be able to say, hey, if you want to be able to gather in small groups with other people who are also vaccinated, then the risk is lower, so you can do that?
So right now, the National Advisory Committee on Immunization, as well as anybody who's really involved in public health across the country, really are saying that at the moment we don't have near that level of immunity in the community right now that would allow us to do that. We don't know the effect. The evidence is just not there yet. The effect of this vaccine will have on transmission and on asymptomatic transmission. So we need to be very careful about that. I think we need to look carefully at the evidence and rely on our trusted sources to be able to do that. So at the moment, we're not making those recommendations. What another country or their body, their scientific bodies choose to do, I think we can watch that and we can look at it, but I think we really have to do what makes us comfortable here. And right now, that's continuing with our public health measures.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi. The AstraZeneca vaccine, I'd be more than happy to have it put in my arm, but I am getting constant comments from people who say it's a second-class vaccine, that it's not efficient, that they would much prefer the other one. They would take the percentages quite literally. How do you get past that reluctance, particularly since you have to be transparent about what vaccine you're giving someone?
So I'm with you, Peter. I take the AstraZeneca vaccine as well. I think it's it's an effective vaccine. What we have to remember is that when you're looking at vaccine efficacy, you're looking at clinical trials, you're looking at controlled circumstances. You're not looking at what happens once that vaccine is being used in the community. And certainly the evidence that's out there now is showing that the effectiveness is actually much more against serious disease, hospitalization, death, when there's a greater period between the two doses. And certainly we are seeing that. So at this point, I think we need to remember that this is an effective vaccine. It is safe. It works well against severe disease, against hospitalization, and against death. And it is certainly very, comparing vaccines, I don't think is really going to be helpful in that regard. They are different technologies, they're different vaccines, but this one is still very, very effective, and I don't think anybody should hesitate to use it, and I'll be getting it myself.
Okay, well, I'll do to that. The other question I have is we talk about not having enough vaccines. In a way now, we're kind of looking at a different problem. If we are getting new vaccine coming here, but we have a whole pile of people who had their first dose of one of the first vaccines, how is that just logistically going to work? Are you going to have a lot of first dose of AstraZeneca and Johnson & Johnson that you can't give anyone because they're all waiting for the other vaccine?
Sorry, are you saying?
Is the question about mixing and matching?
Yeah,
Yeah.
like you can't really mix and match, I
No.
assume. So how is that going to work?
So we don't anticipate that there will be any issue with getting supply of whatever vaccine we need to do second dose. So, you know, if we're giving our mRNA vaccine to people, we anticipate that we're going to have enough mRNA vaccine, you know, through phase 3 or through quarter 3 to be able to give the second dose to those who had the first dose. And the same is true for AstraZeneca and Johnson & Johnson if we get that before the third quarter.
Okay, thank you.
Our next questions are from Patrick Butler with Radio Canada. Please go ahead.
Question for Dr. Fitzgerald. Sports organizations are saying they're worried that the recent outbreak that we saw in the Northeast Avalon is going to have a negative impact on public health's willingness to allow team sports going forward. Has the outbreak changed your approach to permitting team sports activities as we loosen restrictions? And I say that considering that other provinces are still allowing them, and also because in looking at the alert level rules that are on the COVID website right now, team sports are suspended in alert level 4 and 3 according to the guidelines, and level 2 doesn't say for certain whether they can resume. Can you explain that?
So when we're looking at moving forward, especially with variants of concern as being something we have to contend with, which I think you know, will be something we'll probably have to contend more with over the next couple of months for sure, that we need to try to reduce the ways in which people come together and gather and are in situations where there's potentially lots of people who can get infected should, you know, another variant of concern be out there undetected. And so we have to consider that sports teams, in particular, are a way that can happen. We saw that it was a way that it happened previously, and so we have to think about that moving forward. The risk is different now. The risk is not the same as what it was before. The variants of concern are it's like dealing with a different virus, really. It's you know, they're more contagious, and we've certainly seen in that kind of a situation where you can end up with a super spreader event. So we do have to be more cautious, I think, moving forward, and we can't assume that we can just go back to exactly the way it was before. It would be, I think, it wouldn't be good of us to sort of go through what we've just gone through and learn the things we did about this variant and then not really change the way that we do things. That really wouldn't be prudent.
So does that, like, I'm thinking about smaller groups as well, double bubbling that was permitted before the variant. Has your thinking about how double bubbling or smaller group activities, has that changed as well?
So certainly, I think we have to consider that we all have to think about how we gather. So we, you know, it is important for people. We understand that it's important for people to be able to be social with those people they need to be social with. So, you know, with your family, to provide support if you need to have that ability to be able to be close to those people that you need to be close to. But But we all need to think about the way that we socialize and the way that we will continue to socialize going forward until we get to a point where we feel that enough people have been vaccinated, that the vaccine is giving us the protection that we need, and that we can take away some of those public health measures. That's going to take a little bit of time, and I understand that everybody is really tired. We're all tired too. But I really do feel that the light at the end of the tunnel is getting brighter, and I think we just need to hold on for a little bit longer, and we all need to think about things a little bit differently going forward.
I'll now go back through each reporter to see if you have one final question. Kellyanne Roberts with NTV, do you have a final question?
Yes, thank you. Just wondering if there's any changes for rotational workers and their self-isolation orders, and if they're looking to be moved up higher on the vaccination list.
So we're certainly looking at those questions right now, and we hope that we'll be able to develop something that meets the needs both of public safety and of rotational workers, and I hope we'll have some more information on that this week. With regard to where they sit in the vaccination plan, they certainly are within phase 2. Where exactly we do have some people that we have to get vaccinated, those with, who are clinically a little more vulnerable, that we have to get vaccinated, but we certainly will be looking at rotational workers in phase 2.
Thank you.
Noah Shepherd with VOCM, do you have a final question?
Yes, I do. Ontario is moving persons with disabilities such as Down syndrome up the vaccine ladder. Other provinces haven't. Is there any thoughts of moving people with disabilities that make them more vulnerable up the priority list?
So we do have people with disabilities who have vulnerabilities and aren't able to, have difficulties that don't allow them to perform their own activities of daily living, or that they need support with some of those activities of daily living. We certainly have those included on our clinically vulnerable list. That when you look at some with some conditions, there is a range of severity, and so that has to be considered as well. So certainly at this stage, with limited vaccine supply, we are looking at those who are most clinically vulnerable and who are most at risk for severe disease.
Thank you.
Peter Cowan with CBC, do you have a final question?
I do, thank you. Premier, you noticed that our numbers have continued to get better. We're now, dealing with daily single-digit new cases. So why do you continue to be at these briefings, and how do you respond to the criticism that it's unfair for you to be there talking about the good news of a vaccine rollout in a week that many people are voting?
The criticism is the same as it was at the very beginning when we were delivering bad news. The people of the province still have a premier and a caretaker government, and it's the same today as it was 3 weeks ago. The numbers are getting better because of the actions taken by Dr. Fitzgerald and her team, and frankly, how the population has responded. But as we said from the very beginning, a caretaker government still needs to be in place and respond to crises when they happen. And this was a crisis in the middle of an election, and so that's why I'm still here.
Peter Jackson with The Telegram, do you have a final question?
Yes. I'm not sure if there's a lot of clarity around long-term care and personal care homes. There was some suggestion recently that the completion of vaccinations in those places will make them more open to visitors. Is that a likelihood within the next little while, or not?
So all personal care homes and long-term care facilities, assisted living facilities, had their vaccinations done as of, I think this Friday will be two weeks since everybody was completed. We wanted to give that time. It takes about 2 weeks for vaccines to start to have their effect. So we wanted to give that time before we considered opening up visitation further. We think, we understand the importance of visitation to people in long-term care, personal care homes, and assisted living facilities. So we want to make sure that that we're trying to, once again, to balance public safety and the safety of the residents of those homes with the, the wellness and overall wellness of those people. So we certainly are, we'll be looking at that in the coming days.
Thank you.
Patrick Butler with Radio Canada. Do you have a final question?
I do. Just to follow up on Peter Cowan's question just then. Premier, could you explain why it's important for you to be at a COVID briefing in a caretaker role, why it's so critical for the Premier in a caretaker position to be here for something like this, but then when there's a delay announced to the Premier's economic recovery team that you were not aware of this until the moment before, or the night before this was announced, the delay was announced, the publication of the report, and in your press conference with reporters, you said that you couldn't be part of this process during a risk period. Can you explain the differences in those two scenarios and why the role of a caretaker Premier is different in those two situations?
Sure, because in convention, caretaker allows for responsiveness to an emergency crisis. And I think we're all in alert level 5 right now. It's an emergency crisis. And the people of the province need to know that there is a Premier, there is an executive in place that is able to manage it. And so it's that emergency crisis piece. I think we can all agree, I hope we can all agree that that was an emergency to shut the province down to level 5. And so that's the difference, Patrick.
Thank you, everyone. Premier, do you have any final comments today?
Yes, thank you all for joining. Just a reminder, if you are eligible for the latest rounds of vaccinations, please make sure to register. Also a reminder that asymptomatic testing is open, and I went myself earlier today, and the whole thing was very easy and very painless. And in fact, I want to thank the staff there for their dedication and hard work during these troubling times. And please follow Dr. Fitzgerald's advice and continue to social distance, wear masks, and please avail of the pop-up testing. Thank you.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.